I'm Dr. Ayesha Appa. I'm an addiction medicine specialist. I'm the doctor who leads care at Boulder, and I know from taking care of people in clinics, in hospitals, in tents, vans, SROs, everybody actually wants something to change. And one of the narratives out there when I see this in the news or whatever that drives me crazy is that people with addictions don't want treatment. People may not want the treatment that the US medical system has historically provided that has been trauma inducing, but everybody that I have seen wants to change something. And it might not mean stopping all substance use tomorrow, but people want to feel better. They want to feel safer, less trapped, more in control. And too many systems aren't actually built that way. So here are a few things that I think addiction treatment gets wrong and what we're trying to do differently. One, addiction care is backwards. For almost every other chronic condition, say like diabetes, you get the care that fits into your life. You see your medical team from home or in clinic, and if things get really serious, then you might get sick and end up in the hospital. But in addiction treatment, why is it that we have made people feel like the only way they can get real help is to disappear from their life, leave work, leave family, risk your housing, and get admitted to a hospital, and then rebuild everything afterward? That should not be the only door into care. So that's why at Boulder, you can see a clinician in 3 minutes from wherever you are. And medication is not a last resort. For opioid use disorder, alcohol use disorder, medication is just life-saving care, full stop. So it should be integrated as part of wherever you are. 2, we are not obsessed with your pee. Yes, there are regulations we follow. And yes, sometimes toxicology testing is clinically useful. Sometimes people appreciate having that information. But if the whole relationship is built around catching you, punishing you, and deciding whether you've been good or bad, that's not care. If you're anything like the patients that I know, you're carrying plenty of shame. You don't need somebody wagging a finger at you. You need somebody who can ask, what happened? What got in the way? What goal are you trying to reach? How do we get you closer? 3, you do not have to get sober before you're allowed to ask for help. I hear this all the time. He wants to drink less, but he's not ready for treatment. Or they're still using, so they're not ready. And no, if you or someone you love is expressing interest in making a change, that's exactly when treatment should be available. Because again, it should be getting to know you, figuring out what will work for you, not this big dramatic commitment where you're leaving your life to do treatment at the expense of everything else. And if you're worried that you're wait, but I'm still using, how can I go in there and talk to my doctor about using drugs? Respectfully, you ain't gonna shock an addiction care team by talking about drugs. We love talking about drugs. It's our whole job. And finally, good care is not one thing. People need clinicians. They need peers with lived experience. They need help with pharmacies, with insurance, managing relationships with family, housing, stress. And that is what our model is built around, being able to access different types of care and different touch points from different people. So that's a little bit about the type of clinical care that we provide at Boulder. You deserve a team that starts with where you actually are and helps you along to the next step and does it with a lot of love. And that's the type of care that we provide at Boulder. I hope this was helpful. Ask us questions. Send this to somebody who didn't know what treatment could look like.